So today I'm talking with Dr. Bridget Walker. She's a well-known expert on child and adolescent anxiety disorders. Earlier in some of our conversations, you have mentioned CBT therapy, cognitive behavioral therapy. For viewers not familiar with this type of therapy, can you walk us through what it is and why you so believe in it?
Absolutely, I can, and I'm going to get a little technical because I do think it's very important, and it really helps when parents and actually adult patients of mine understand what cognitive behavioral therapy is. So here you go. So cognitive behavioral therapy has been around for decades. It's the most highly studied kind of therapeutic modality there is. And it's an integration of two kinds of therapies. Cognitive therapy, which was invented by Aaron Beck, who recently passed away. And he was a psychoanalyst studying Freud's theories, and he could not find evidence to support them. So he started noticing that people make thinking errors all the time. Some thinking errors that people with anxiety make are catastrophizing, meaning assuming the worst case scenario is going to happen. Overestimating that probability, futurizing. There tends to be a tremendous future orientation with anxiety. And that when we make these thinking errors, Beck discovered, we feel emotionally as if they're going to happen. In a sense, we believe them. So if I walk out the door and I have the thought, when I get in my car, I'm going to get hit, I'm going to feel pretty worried because I've just told my brain this is going to happen. So those thinking errors lead to a high level of distress. And people don't like feeling anxious, they hate it. And this is where behavioral therapy comes in, which is essentially based in B.F. Skinner learning theory. And the thing about anxiety issues is people hate feeling worried, so they do behaviors, they resort to behaviors to make it less likely that the feared outcomes will happen. For example, if I walked out the door and thought I was going to get hit by a car, I might do a behavior of checking. I might check a lot, right? Or I might look out the window. I might check before again. So those behaviors, what we have learned is that it's those behaviors that feed and maintain anxiety. So avoidance is another behavior that people do to make it less likely that a feared outcome will happen. Washing, if you have obsessive compulsive disorder and you have contamination worries, washing your hands or avoiding touching things, those are behaviors that we do that we think is going to make it less likely that the bad thing that we are afraid is going to happen will happen. And what we know is that all those behaviors are the things that feed and maintain anxiety disorders, that they are the buggers.
It sounds like people are just trying to protect themselves.
Of course they are. They are. And God or whoever created us didn't do a great job on that count. We're just set up to be that way. And that's probably why anxiety disorders are so common.
So why do they perpetuate? Is it just because we learn these behaviors and we feel like we're keeping ourselves safe?
Relief from distress and anxiety, our brain experiences as a reward. Right? So that when our brain feels that something's rewarding, we'll do more of it. So they become habits very quickly. And unfortunately, when we avoid things, we don't learn anything different. So we become trapped in this cycle, or if we do other behaviors to mitigate the feared consequences, we become trapped in a cycle of anxiety because we never have the chance to determine whether if we didn't do those things, we would be okay, which we would in 99.9% of the instances, right? So that's how they are perpetuated. There's other factors too, especially with kids. Of course, anxious kids are much more distressed than non-anxious kids. Even everybody gets distressed, but parents, because of that, often change their behaviors to alleviate a kid's distress. So if a kid, for example, is afraid of natural disasters, a parent might stop watching the news. So the kid isn't exposed to that. Well, that may work in the short run, but then the next time the kid is exposed to that, the kid won't have ever had to face it and realize that he can handle it, hearing about this stuff. So parents often fall into these behaviors well-meaningly, but what we know is that parental accommodation, meaning changing your behaviors to alleviate your kid's distress, is positively correlated with symptom severity of anxiety disorder. So it's kind of counterintuitive because when you're a parent, you think, you want to protect your child. Well, if your kid has anxiety issues, you have to be very careful about that. Yeah.
So it almost sounds like we're feeding an anxiety disorder when we make accommodations.
Yes, that is exactly true. Parental accommodation functions just like avoidance or other behaviors that people adopt to mitigate the feared consequences, yes.
So when you believe your child may have an anxiety disorder, is the treatment as important for a parent, or at least the information and education as important for a parent as it is for the child?
Absolutely. In my practice, I always work with parents I have them monitor themselves. I think, they monitor their kids and monitor their responses. What did you do when Johnny said, I'm going to fail this test? And was studying until 4 a.m, even though he knew and you knew that he knew the material.
What I'm hearing from you, I think, is that when it comes to anxiety disorders in children and adolescents, it seems that the parent has to get educated, or the parent has to be retrained to avoid making these sort of accommodations. Is that correct?
Yes, it is. And as I said, parental accommodation is a very well-studied phenomena. And my colleague Eli Leibowitz at Yale Child Study has done a couple of longitudinal studies where he only worked with parents to reduce and eliminate those behaviors, and the kids all got better.
Wow.
So it's important that parents understand what responses are accommodation behaviors. Most parents are great at it, and I mean, most parents are willing to do whatever they can to help their kids. They just don't realize that those behaviors, providing excessive reassurance, allowing avoidance, that those things are actually harming rather than helping their child. So yes, it's crucially important. And of course, the younger the kid, the more likely they are to go to their parents when they're distressed, right? So it's even more important in parents of younger kids to know about these behaviors and to identify them and change them.
And to change their own patterns of parenting at an earlier stage.
Completely. And the good news about that is the kid doesn't have to do anything. So the parent can change their behaviors. And it's very, very important.
Thank you so much. I've learned so much about CBT, and if I'm not mistaken, I can find out more about this on your website?
Right, drbridgetwalker.com and childanxietyscreening.com. There are many resources in both places for you to educate yourselves and make whatever changes you need.
Thank you so much.
You're welcome, thanks.